Yep.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah, yeah.
That eye's watering as well.
Runny nose?
No, it's blocked.
Blocked nose as well?
Yeah.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. Right. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No, it won't be, love, no. It won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you most, isn't it?
Even though it's me, and you know, like if I go like that.
Yeah. That's what it feels like.
I can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just seeing
it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sleep if you want.
Right.
Right, thank you.
OK.
69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
OK.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr. James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay dropped down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
It's really blocked, isn't
not
it?
That one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albus oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that should open it up.
Right.
Well, I'll go and do the prescription. I'll take Gemma with me, I'll go and sign it, and she can bring it back for you.
OK.
Is that OK?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. Hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
OK, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
OK, look.
And if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken so long today.
No, it's all right. Thank you.
Take care.
Bye. Bye.
Come in. Hello, is it Victor?
Yes.
Hi, Victor. Come in. You're looking very smart.
Thank you.
Is that for my benefit?
Oh, yeah.
Go and sit down. Right, how can I help?
Well, yesterday I was going down to pick up my little brother from school, and when I was walking down, I started feeling a sharp pain, lower right side of my abdomen.
OK.
So every time I put weight on my right leg, the pain started coming more and more.
Sure. OK.
For the first time, I didn't go to football, which was...
OK. So that's a big deal, is it?
It is, yeah.
Fair enough, yeah. And is the pain there now as well? OK. And how would you describe the pain?
Kind of piercing towards, like, some of my bones, I'd say.
Yeah?
Yeah, just the top there, just at the front.
Any nausea, vomiting?
No.
No? Going to the toilet okay?
Going to the toilet a lot.
A lot,
Yeah.
okay. Do we have a feel of your tummy? Do you want to just come up on the couch for us?
Yeah.
Are you worried it might be anything in particular?
My mum said that it could be something with the appendix. I just thought it was a bladder.
Yeah.
So-
Well, it's around the same place as your appendix, so it's something we need to rule in or out, really. So just relax, head back, nice and relaxed. If you just point to where you're getting the pain.
It's right there.
Around there. I'm just going to start on this side. Is that sore?
Yeah, there.
About there. Okay, that is sore, isn't it? Okay. I'm just going to check your pulse. And if you had to describe the pain,
Yeah.
kind of 1 to 10, where 10 is the worst pain you've ever had,
Oh,
what would you say?
it's probably like an 8, but
8, okay. I'm just going to have a listen into your bowels as well. That all sounds fine. Do you think you'd be able to give me a water sample?
water, yeah?
Yeah?
Should
Come on then. Seen in your records you're from Malawi, is that right?
Yes.
Yeah, how old were you when you moved?
I was 5.
Were you? I did some work in Malawi, actually, in Blantyre. I did some voluntary work in a hospital over there for 6 months.
Do you remember the name of the hospital?
I want to say Queen Victoria or something.
That's where I was born, I
Was
believe.
it?
Yeah.
Yeah?
I believe that's where I was born.
There you go. The urine is absolutely clear,
Okay.
but that rules out a urinary tract infection,
Yeah.
but it doesn't rule out appendicitis. The only real way to find out is to send you into hospital for them to do some blood tests and a potential scan and keep an eye on you.
Yeah.
I'm going to give the hospital a call. I'll tell you exactly where to go. It'll be the Bradford Royal Infirmary. Do you know where that is? Yeah. Okay. Hi, can I make a surgical admission, please?
Did you always want to be a GP?
No, not really. When I was younger, I wanted to be a vet. I don't really know what happened. I applied to do medicine instead. I think my mum was a deciding factor in that. And then I thought about doing paediatrics for a long time. In fact, when I was in Malawi, I was working in paediatrics, which I really enjoyed, but then I missed adults and conversations with adults and that kind of thing. And with general practice, you get the best of both worlds. You see children, you see adults, you see a bit of everything. Hi, thanks for taking my call. My name's Amir. I'm a GP calling from the Ridge Medical Practice. Hi, I was wondering whether you might be able to take a look at an 18-year-old chap for me who I think might have appendicitis. Started yesterday, gradually got worse. Describes it as 7 out of 10 in severity. Otherwise fit and well, yeah, hardly ever comes in. Thank you so much for that. I appreciate it. Cheers. Bye-bye. Yeah, they're happy to see you up there. I'll just give you this to take. I would go home, tell your mum, pack an overnight bag in case, and then go to Ward 20 at the hospital. There you go, Victor. Best of luck, mate.
Thank you.
All right, thanks for coming in. Cheers. Don't forget your jacket. Nothing to eat or drink until you've seen them.
All right, that's fine.
All right, okay. Cheers. Take care, mate. Bye.
See you.
Come and take a seat, because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before,
Yeah.
yeah.
Is it sore?
I feel sore, yeah.
So
Yeah.
what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and it can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
OK.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
Come here, love.
Right, so looking inside, there is quite a bit of red blood actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh, God.
But I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
There we go. Oh, you're lovely. Thank you very much.
That's all right. So,
Thank you.
my job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
OK?
Yeah.
I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much. You've
OK,
been
you
lovely.
take care.
Thank you.
Thanks for coming in. Thank you
Thanks
for
ever
bringing
so
your mum in.
much.
You get the door. There you go.
Right, thank you.
OK.
Come on in, have a seat. Right, I'm Dr. Caris. This is Caroline with us today.
How do you do?
All right, thank you. Right, something on your back, is that right?
Yeah, I've got a
Doctor?
cyst. Yeah.
Tell us a bit about it.
I've had it for a couple of years. It does fill up, and then when you lean back on a chair, it's tender.
Does it leak and discharge?
Well,
things?
I end up getting my to squeeze it. Yeah.
And then you get sort of cottage cheesy
That's
type
right,
stuff
yes, it
out.
stinks,
yeah.
yes.
Smelly, isn't it? Right.
Yeah.
And you're keen to have it removed? if
Well, I've had it a
possible?
couple of years. I want to get shut of it now.
Right, would it be all right to have a quick look
Yeah.
and an examination, and then we can have a chat about it? Do you mind if we just lift this up? This is it in the middle, isn't it?
Yeah.
Is it all right if I just have a
Yeah,
gentle
yeah.
examination? And when was the last time it leaked?
About 3-4 months ago.
OK, so a good while back. You can see the little head on it, can't you? Yeah, OK. That's fine, right, thank you. So, these things are very, very common. Most people, at some point in their lives, will get one of these somewhere on the body. The scalp and the back are the two most common areas, and they're just a blocked oil gland, and we've got oil glands all over our body to keep us waterproof. So what would involve is numb it with an injection. That does sting a touch, OK, for about 10-15 seconds. Cut over the top of it, shell it out like a pea in the pod, and then put some stitches in. OK. Grand. Right, you don't mind us if we just lift this right up? Perfect, yeah. So the injection does smart a touch, I'm afraid.
I gathered it would do.
But only for 15 seconds max, probably. Right, are you set? Here we go. 3, 2, 1. Touch more. Right, just give that a bit of time to take effect.
Well, that wasn't as bad as what you were making out.
Yeah, I wondered sometimes if I do overplay it a little bit. Any of that sharp? How's that?
Yeah, I think you're all right with that.
Not sharp. So how long have you had this one for?
3 years, I think. Maybe a little bit longer.
Key to it is getting all the lining out to try and stop it coming back. It's just what I'm doing now.
Well, I don't want you coming back, but...
No. They're not much fun, are they?
No.
You okay there?
Yeah, fine.
Good, it's coming out nicely in bits and pieces, which is what I was expecting. I think we've got all the lining out now. Good. Couple of little absorbable stitches and then you'll be home in time for breakfast. Second breakfast.
Oh, no.
Do you not have a second breakfast?
No.
I try and have a second breakfast whenever I can.
A cup of coffee.
My second breakfast usually starts before I go to bed at night.
Non-stop eater.
Unfortunately.
A grazer.
I like to graze as well.
Yeah, I just can't. I've got no willpower when it comes to food.
What would your ideal second breakfast be?
Bacon butty with an egg, a runny egg, brown sauce.
If it goes in a tea cake, I'll eat it.
So these stitches absorb from the inside out.
Okay.
So the last thing that goes is the knot. It usually takes about 3 or 4 weeks. Tiny little nick, but we've managed to get it all out through a little, like keyhole surgery almost.
That's fine.
We're not going to send anything off to the lab to get analysed because it all just come out in piecemeal, and it certainly was a little cyst.
Yeah.
We'll put a little dressing on now, which he just asks you to leave on for 24 hours and keep it dry for that period of time. OK? Any questions you want to ask?
No, I'm fine with that.
Grand. Right, we'll just lower you down and you can sort yourself out, get your cup of coffee.
Ooh.
She does a good breakfast upstairs, actually. There's a little cafe upstairs. OK?
Right, yeah, thanks very much.
All right, we'll leave you to it then.
Cheers,
Okay,
thank you.
See you later.
Hello. Please come and have a seat. My name is Dr. Hag. Yeah. What can I do?
First of all, I have a lot of breakdowns. I constantly feel like I just don't want to do anything. I don't want to wake up. I have a feeling of guilt and shame at the same time. Like it's just like a lot of emotions just going on inside.
And how long would you say has all this been going on for?
For a very long time, actually. But then, obviously, you have better days and you feel, well, it seems like I'm going to be much better.
Yeah.
But then it just comes tumbling down
And what's
again.
made you come now, sort of, if it's been ongoing that long?
I'm a bit concerned now because I can say before she was born, when I was still a student and everything, when you're feeling like that, like you would self-medicate. I used to drink a lot, do you know what I mean? Chill with friends, smoke a lot. Yeah. But then now it's like you're dealing with everything sober-minded. It's like you can feel it more, and I'm just like really scared of like the dangers of it because I was self-harming before.
Okay.
So I just don't want to get to that point again.
Have you had any thoughts of self-harm during this time?
I have.
And what stops you from doing anything?
Her, yeah. She's really been my push most of the time.
Okay. Have you been on any tablets before?
No.
Never been on tablets?
Yeah.
Okay. Has anything recently happened that might have triggered it?
I think it's just loneliness nowadays, yeah.
Okay. Who else do you have at home with you?
Just me and her, yeah.
Just you and her. Okay. And are you working?
No.
And what about your sleep and appetite? How is that?
I don't eat at all. Like yesterday, I think I had like a bite of a chicken and that was it. So my eating has really gone downhill because I used to have that strength of like cooking for her and everything, and I'll feel motivated and all of that. That's all gone out of the window now.
Okay.
And my sleeping, I don't sleep until like maybe 3, 4 a.m.
Okay.
Which makes it harder even to wake
And do you
up.
feel anxious as well, along with your mood being low?
Yeah, I'm constantly nervous for some reason. I don't know why. Like there's just that anxiety in everything that I do.
Okay. Well, I'm glad that you've come to us. It is a big thing that you've come to us so that we can help you. It sounds like it's a long-standing thing and you've just been coping with it, but now that you're at this point that you really feel that you want something to help you, there's medications that we can give you that help with your depression. So that's an option. The other option is non-medication. That's like counselling and stuff, which will sort of is more long-term that we're looking at. What are your thoughts about trying a tablet?
To be honest, I'm open to any options, but then I think the most important that I would want to have is talking to someone because I just feel like I have a lot to let out.
Yeah, and I think, no, that's fine, that's absolutely fine.
There we go.
It's okay. No, it's okay. Take your time. It's okay.
Whew, I don't even like her seeing me cry.
What I'll do is that let's start you on a tablet, something that's called sertraline. I'll start you on that because it works for anxiety as well as works for the mood bit as well. We start off on a low dose and gradually build it up. So what I would like to do is that give you the tablets and see you back in about 3 weeks' time. Okay. If it's not making much of a difference, we increase the dose, but we do it on a gradual basis. Is that okay?
Yeah.
So I'll do that for you, and then I'm going to give you a leaflet which has got some numbers on it which you can contact. That's for counselling. Just print that off. So this tablet, usually people tolerate it well, but it can make you feel a bit sleepy, and it can also cause some problems with your stomach, so like indigestion or heartburn. Most of the time things settle down, but if it doesn't, let us know. So that's the number first response. That's like a crisis number. They're a 24-hour service, so like, you know, if you felt really low and depressed and you were unable to cope with things, you can ring them up. They will talk to you and they will go through things with you. So just like, is that okay?
Okay, that's fine.
Then that's your tablet. So that's your tablet. So sertraline 50 milligrams, one tablet once a day, and then let's see you back in about 3 weeks' time, just before your tablets run out.
All right.
Is that okay?
Yeah, that's fine.
Anything that you want to ask?
No, I think that's okay, really. Yeah.
So,
Yeah. Thank you very
You're
much. I
welcome.
appreciate it.
I'll get the door for you.
Hi, I'm Dr. Khan. Nice to see you.
Nice to see you.
Hiya, you're right. Who have we got here?
It's my daughter Caprice.
Oh, hiya, Caprice. That's a nice name.
Thank you.
Right, I understand you've got a lipoma. Yeah. And what do you understand about the term lipoma?
Nothing really. It's just like a fat growth.
Yeah, it's just a lump of fat. Sometimes the body just kind of deposits it in this kind of circular growth.
Like the past 2 years, you've just noticed it and it just seemed to get bigger all of a sudden.
Maybe I've had more holidays and noticed it more.
Your shark fin when he's swimming in water.
Is that why? Does it just kind of come above the waterline?
The meg.
Yeah. Should we have a look at it?
Yeah, of course you can, yeah.
Oh, it is a big one, isn't it?
Yeah.
Okay. Right, yeah, we'll take that off for you
okay with
today.
that,
Yeah.
I've seen one bigger than that before. Yeah, good.
No, it's my first one. It was bigger than I was expecting because in the letter she's referred to it as a 1.5 centimetre lipoma. So I was just surprised. All right, so we'll get it all out. We just need your top clothing off.
Okay.
So if you just lie on your front.
On my front.
Yeah, that's it. Right, so I'm just going to give you your first injection now. So here we go,
Okay.
it's just a sharp scratch. Can you feel that?
Yeah, but it's not sharp pain.
I'm going to start, and then if it gets
Okay.
painful,
Yeah.
let me know, because I think what you're feeling is more pressure, but we'll have a look and see what you think. What does that feel
I
like?
felt like a scratch up.
Is that, yeah? Let's try a bit more.
You don't want to part with it, really, do you? Have you got quite attached to it after 20 years?
Right, if it wasn't big before, it is now, because it's full of fluid.
Get to play football with that when it comes
Yeah.
out.
Right, let's see what we're dealing with now. Is that okay?
Yeah.
Yeah. So Ellie, you can see that it's kind of a pinky colour at the moment, which is a cutaneous tissue, but just lurking underneath that, you can see spots of yellow, and that's the lipoma. Mm-hmm.
How are you doing?
Yeah, I'm doing good. Yeah, I'm quite relaxed now, yeah.
How are we doing? It's impressive, isn't it? Yeah.
I suppose it's like trimming a ham.
I don't want that on my Sunday roast.
Like alien, isn't it?
God, it looks like an organ. Massive.
A church organ.
Are you okay?
Yeah.
Yeah.
I'm good, thanks.
We're nearly there now, it's coming
Good.
out. Okay, we're going to need a big pot for this one.
I think we've only got one size. Yeah, it's nearly there.
Good.
Nearly there. I don't think you're going to get all that in pot that we've got.
It looks a bit like a chicken breast.
It does a bit, doesn't
Before
it?
it's cooked.
Yeah.
So how many stitches will this take?
Probably 5 or 6.
Do you have to do needle crafting for this as well?
Yeah, crochet. knitting. You know what? I can't.
If you can do that, you could definitely do buttons.
I don't know. I've never tried. Right, I'm just going to give it a cleaning. We'll put a dressing over it.
Okay, fine.
It looks good, Dad.
Good.
Oh, thanks, Caprice. Does that feel better?
Brilliant.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know.
Okay,
that's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because
Yeah.
when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing.
Yeah.
Then it gets really itchy. I mean, as you can see, the skin gets really dry.
Yeah.
And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had, anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that.
Do I need to book out the
Yeah. But just use the words health check, NHS health check.
Right.
And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just,
I mean, to be honest with you,
general MOT, but
yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. What about these chest pains?
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when you're
catches me
breathing?
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
Yeah, it's that type of thing, you know what I mean?
Okay.
And when I'm breathing, you know what I mean?
Right.
It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway.
Yeah.
Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah. And you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know what I mean? I'm trying to reduce them as much as possible and hopefully, you know, come off them, but it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Yusuf.
My pleasure.
Thank you.
Bye.
See you.
Hi, I'm Linda Eves. How can I help?
I've just started last couple of weeks with having quite severe dizzy spells. If I'm rotating my head, I get quite dizzy.
Okay.
Yeah, it's just causing me some issues.
Yeah. It sounds a lot like benign positional paroxysmal vertigo. Have you heard of that, BPPV?
No.
Okay.
No,
it's
it's a good one.
Thing,
Yeah, well done. Yeah.
Classically, it's sort of rotational movements of the head. It can be looking up or down or turning your head to one side, and it tends to then set off this sensation of spinning or turning or unease. Is your general health good at the moment?
I've just done the Yorkshire Marathon, so
okay. Well,
I got around there okay, so I think I'm okay.
You're okay. Let's check your blood pressure. It's fine, no problems with that. 122/80.
Yeah.
Just tilt that slightly that way. Great. Okay, well, there's nothing in the ear canal that's causing any increased symptoms, and there's no signs of infection or anything. So if you're happy for me to go ahead, I can do what's called the Epley manoeuvre. So in the semicircular canals in your inner ear that are responsible for how you orientate and so on, they can get some little tiny crystals that form in there, which when they move over some little hairs with fluid, they create a sense of imbalance.
Okay.
And so the repositioning techniques help that.
Okay.
Right. Ready?
Yeah, ready.
Okay, down you go. Okay, keep going, head over the edge, right down to the back. How do you feel?
Yeah, it's just wobbling a little bit.
Sit yourself back up. Have you noticed at home or whatever if there's one? Okay, that's worse, isn't
That
it?
did it, yeah.
That did it. Are you ready?
Mhm.
Okay. So lie yourself back. Okay. Right over here. How do you feel?
Yeah, that's doing it.
That's doing
Yeah,
it. Okay.
yeah.
Turn over this way. Tell me if it sets it off.
Yeah.
Yeah. Oh.
yeah, right. And it's normal again now.
Okay. Keep turning your head a bit further over. That's good. Stay in that position. Turn your head a bit further forward. That's perfect. We okay like that?
Yeah, I'm good, yeah.
You're good. Bring your knees forward, so you're going to end up sitting forward facing my desk. Okay, how are you doing?
Yeah, I'm pivoting side to side rather than going...
Okay.
Rather than it being dizzy. That's it, settle down now.
Settle down.
Yeah.
That's quite quick. We'll get you back over in the chair.
Yeah.
You all right?
Yeah, good.
Okay, up you get then. Okay, keep looking there. Round over here. And sit down. Okay. You can't drive when you've got symptoms of vertigo, so looking over your head and so on. Hopefully, with this repositioning now, things will be quite a bit better.
I think I'm at that age where I'm collecting things now. So it's, yeah, the eyesight went last year. The,
did
the
it?
ears
Yeah.
went 2 years before, so it's just waiting for the next thing.
Good morning. Have a seat. I'm Becky, one at Nurse Practitioners.
Hi.
Hiya, how can I help today?
The thing is, I've been having problems eating till I get a breakfast in town. It goes right through my system. It gives me diarrhoea every time.
Okay.
And I've been out for the last couple of weeks.
Okay, so have you had diarrhoea every day for 2 weeks then?
Yeah. Till I pass urine, it smells horrible.
Okay, so you've got smelly urine as well?
Yeah, I've had it for a long time.
How long have you had the smelly urine for?
Too long.
For a long time?
Yeah.
And how many times a day are you having the diarrhoea?
It's every time I go for something to eat, like a breakfast in town. So I have a breakfast every morning, see, in the cafe.
And what do you have in the cafe? Is it like a fried breakfast or...?
Egg, bacon, sausage, tomato and beans.
And you've eaten in the cafe for a long time, have you?
Yeah, I always have a breakfast in the morning.
And have you been travelling anywhere or done anything different?
No, not really, no. I went down to my mum's 2 weeks ago to arrange for a funeral.
Oh, dear.
I lost my brother.
Oh, so you've had a rough time of it, haven't you?
I lost 2 husbands. One uncle, 2 cousins, and my dad. It's gone all wrong.
Yeah.
It's gone all wrong.
Yeah. That's fine. Do you want to come behind the curtain? Can you give me a cough? Can you pull your tummy in and push it out? That feel okay?
Yeah.
Yeah? Thank you. Have a little feel. I'm really sorry, my hands are always cold.
That's right.
I suppose the only other thing that we could do this morning that we haven't done yet is have a little feel into your bottom. So if you lay onto your left-hand side, facing the wall, that's it, and then draw your knees up to your chest, and then you'll just feel some cold jelly on my gloved fingers. Is that all right?
That's fine.
OK, lovely. That's fine. Well done. So your tummy feels fine. You've no high temperature at the moment. OK, that's good. This could be a bit of a bug that you've got, although it's gone on, 2 weeks, hasn't it?
Yeah.
So I want to do a couple of poo samples, OK,
Yeah.
for you to do. And then I want you to get some bloods done this morning.
That's fine,
Is
yeah.
that all right?
Yeah.
Do you think you'll be able to go home and have a cup of tea, and we need to get plenty of fluids into you?
I will do, yeah.
Yeah, OK, and make sure that you're weeing regularly.
Yeah.
We'll send that urine off as well, OK? If your pain and everything gets worse, I need you to come back sooner. The blood results will be back by the beginning of next week, OK? And I'm just going to sort out for somebody to do your bloods now. All right,
Okay,
so
yeah.
you can put them in your bag. So have a seat in the waiting room.
Yeah.
And you'll get called through shortly to have a blood test.
OK.
Is that all right?
Yeah, it's fine.
Yeah. You take care.
Yeah.